The Pharmaceutical Company Limited consists of 5 clinics and 4 hospitals spread across Accra. As well as championing curative care, we are also big on preventive health, and we do that through the running of our wellness clinics and our starship programs of Pink October and then Blue November. This year, we've decided to add on World Diabetes Day celebration as part of our portfolio. We encourage everybody to get tested, know their status, and see a doctor at any of our facilities or any facility close by you. We'll be doing free screening at selected places, and we'll also be doing education to market women and also corporate clients across Accra.
Diabetes is a metabolic disease, or is an endocrine disorder. When we say endocrine disorder, we just mean that there are hormonal problems. And we all know that when we eat, we break down the food into sugar. And this has to be handled by a hormone called insulin. So when you have a problem with your insulin, that is, if you are not producing enough, or if what you are producing is not effective, then your body is not able to handle the sugar, and then the levels rise in the blood. And this is what leads to all the problems associated with diabetes. Now, there are 2 main types of diabetes. We have type 1 diabetes, where you really have no insulin at all, or we have type 2 diabetes, where you have insulin but it's not enough, or it's also not very effective. Then we can talk about gestational diabetes, where you develop diabetes during pregnancy, as well as other forms. But by and large, the 2 main types are type 1 and then type 2.
Diabetes is a disease of public health importance. Globally, there are about 422 million people living with diabetes, and this accounts for 5.2% of the world's population. In Africa, more than 24 million people are living with diabetes. When you come to Ghana, we have more than 2.4 million people living with diabetes, and this accounts for 7.5% of our population. We have more than 1.5 million people dying from diabetes and complications of diabetes annually.
Now, regarding the risk factors for diabetes, there are several risk factors. In fact, even being black, is a risk factor, African race. So as we are Ghanaians, that alone is a risk factor on its own. Then as we grow older, the risk of diabetes also increases. So getting older is also one of the risk factors for diabetes. Then we have family history. So if you have a strong family history of diabetes, your risk of developing diabetes is relatively high compared to somebody who does not have a family history of diabetes. Then some of the other additional factors, if you abuse alcohol or if you use excessive amounts of alcohol, that is a risk factor. If you are obese or overweight, that is also another risk factor. Then we can talk about physical inactivity, and then not consuming enough fruits and vegetables or diet high in fiber. So all these are some of the risk factors for the development of diabetes. If you notice that you are passing a lot of urine, drinking a lot of water, losing weight, when you have wounds, they don't heal properly or they take a long time to heal, you are having recurrent infections, especially fungal infections or urinary tract infections, it could mean that you are developing diabetes. But to a large extent, most people with diabetes do not have symptoms. These symptoms that I have talked about occur predominantly in younger people with type 1 diabetes. But for the older adults who typically develop type 2 diabetes, they may not have symptoms. And that is why we encourage screening. You screen and then you may observe, especially if you have risk factors, as I have alluded to earlier. then you should avail yourself for screening so that we can make the diagnosis early and intervene to prevent all the complications that can arise. So if you notice that you have any of these symptoms, you should report to the nearest clinic or hospital and then ask to be tested. It doesn't take much, just a simple prick of the fingertips, and then we get a small sample of blood to determine the blood glucose level. And then subsequently, we can do more confirmatory tests to establish the diagnosis of diabetes. We have quite a number of challenges. One of them is access to care. You see, diabetes is not a one-man show. You need a whole team to take care of the patient with diabetes. You need a dietitian, you need the pharmacist, you need a diabetic specialist nurse, you need a clinical psychologist. And elsewhere, they have people they call biokineticists who help with exercise therapy. But in our setting, we can also get the physiotherapists involved so that they assist in the patient with exercise activities. Then we talk about the cost of the drugs. We know we are in a challenging economy. The cost of some of these medications aren't cheap. And so some patients may struggle to get all the medications that have been prescribed for them. So the cost of the medications is also one of the challenges. Then our health-seeking behaviors. Ghanaians normally don't go for checkups unless they have a problem. And that can be a challenge because diabetes is largely asymptomatic. You may have diabetes for a very long period of time without knowing if you do not check. And so we have to develop the habit of going for checkups so that we can diagnose the condition early.
Diet plays an important role in the control of blood sugars in diabetes. Knowing the type of food to eat, in what portions, and at what time is very important in controlling the blood sugar. Our foods should be mainly vegetables, which are high in fiber, and then also try and control the carbohydrates, the portions you take in. Also, you should try and avoid the simple sugars, which include sugar, soft drinks, cakes, biscuits, which are loaded with sugar and can raise the blood sugar levels. As we celebrate World Diabetes Day, I'll encourage you to see a dietitian to have your meals planned.
The care of diabetes can be expensive if we don't take action early. So talking about cost, let's see what treatment options there are. So it's about lifestyle changes, basically watching what you eat, doing regular exercise, checking your sugars regularly, counting your carbs as the dietitians will say, and also taking your medications regularly. So if we do that, if you do these things, then obviously we can't control our sugars, hence our diabetic status.